Welcome back. All this week, we'll be joined by medical experts sharing important information that is so vital right now. Here with essential supplies every parent should have at home is Dr. Holly Phillips. Great to see you, Doctor.
Thank you so much for having me.
I know we're starting with ibuprofen and this, which I can't pronounce.
Exactly. It's ibuprofen and acetaminophen.
The acetaminophen, of course.
You know what? Most people know acetaminophen by its brand name Tylenol, but acetaminophen is generic and just as good. They come in baby versions, kid versions, and it's something you really need to have on hand. Acetaminophen is usually the first line agent to treat kids who have fevers. But one little piece of advice I give parents, not every fever in kids needs to be treated with medication. If it's a low-grade fever, if it's under, let's say, 100.4, and the kid looks fine, you know, they're playing, they're not uncomfortable or cranky, it's fine to just watch it. Take the temperature again in an hour. You don't necessarily just need to treat the number.
Are these things that we have at home and travel with when we're going on a trip?
Yes, I suggest we take it all.
Okay, what's next?
Next is antibiotic ointment. This is very straightforward. Tons of versions over the counter. They all work, they're all fine. For cuts, scrapes, but particularly kids often get infections from scratching their bug bites. So if you see they've really dug in there with the dirt and bacteria under their nails, put some antibiotic ointment on.
I find it challenging not to pick my zits.
You know when you get those and it makes it worse? You could use this on that too.
Okay. Nasal spray for kids.
So this is decongestant nasal spray. It actually should never be used in kids to decongest.
Okay.
However, it's great to keep in your first aid kit because it can help to stop a bloody nose. If they start to bleed, you use a couple of little...
There's a eureka moment.
It's true. A couple little sprays, sit them up, apply pressure. So it's not for its intended use, but good to have on hand.
Got it.
This is Menthol Rub, my grandmother's favorite. She put it on all the time, everywhere. It just warms the chest, clears up your nose.
That'll linger for days.
Indeed. And I think for cough, natural is best for kids. There are some over-the-counter natural honey cough medicines, or you can use real honey. This is Manuka.
Manuka.
1 teaspoon, not for babies, but for kids.
Is this the best honey to use?
I like this one. I find it works well for my kids, and it's generally safe.
Perfect. All right, we're going to come back more with Dr. Holly with Kelly Ripa. She joins us right here. Stay with us.
All right, we are back with Dr. Holly Phillips, giving us so much great information. Tell us about the digital thermometer, because now you have to check temperatures all the time.
Absolutely.
Right?
So just like you said, it has always been an essential. It is even more so now. They're really easy to use. You just point it at the forehead, about 1 inch away, press, and go. You know, a lot of kids need their temperature taken before going to school, if they're in in-person school now. There's a catch with digital thermometers, though. They're very sensitive to ambient temperature. That means the temperature of the room. So if you store it in one room and then take it to another room to use, you might get an inaccurate reading. My advice is to use it in the room that you store it. Bring the kid to the thermometer rather than bringing the thermometer to the kid.
That's a good idea. That actually makes a lot of sense.
Yeah.
Okay, so now liquid allergy medication.
Yes.
Tell me the difference between this and like just a tablet.
Right. So this is generally better for kids. It's for mild allergic reactions. Things like hives, rashes, bee stings. Even if it says non-drowsy, it'll still probably make kids drowsy, so it's better to use at night if you can. But again, mild allergic reactions with this.
Got it.
Whereas EpiPens, for severe allergic reactions, they are life-saving. You know, what we call anaphylaxis.
And you say to have 2 on hand.
Absolutely. So you want to have 2 on hand because, number one, if something goes wrong and it's an emergency and you're trying to use it and one doesn't work, but also sometimes you actually need to. You use one, you wait 20 minutes, and you might need to use it again.
And say if you're a parent who has a child visiting with allergies, you have to put it you have to jab it into the leg, right?
Yes. So whether or not you have allergies, you should be prepared for guests who do. There are great resources online, Kelly. A lot of people are scared to use it because it seems daunting.
Scary.
Yeah. They're very easy to use. You can watch videos online. The other thing is if you find yourself needing to use it or you think you might need to, call 911. They can help you decide whether or not to use it, and they walk you through exactly how to do it if you need to.
And what about ACE bandages? These are always in my medical bag at home, and I'm never sure why.
Exactly. You know what? They're just great. They can hold strains and sprains, make them more comfortable until you can get them assessed. You can't really hurt yourself with them. Just make sure you don't do them too tightly. That's the only
And what
way you
about
can get into
masks and
trouble.
shields? Should we go everywhere now with masks and shields? I do.
I'm going to say yes.
Yes,
You know,
okay.
I have so little to say about it, but it's the most powerful thing. Just use them. That's it, period.
Use them. I always have extras, too.
Absolutely.
I always have
My purse
extras.
is full now.
Yeah, me too. For all of these tips, Dr. Holly, it's always so great to see you. Thank you so much. You can go to kellyandryan.com for more of Dr. Holly Phillips tips. And coming up next, Sarah Bareilles joins us. Stick around.